Hi, it's Sandy Wiley. Welcome to my channel of mental health, 50 Shades of Black and White, where I talk about my own mental illness, borderline personality disorder. I talk about a host of other mental illnesses, narcissism, bipolar, schizophrenia, post-traumatic stress disorder. I talk about my therapies. I talk about a host of everything to do with mental health, trying to wipe away the stigma of mental health. And I share my own personal experiences with you. I only come on here as a patient of 20 years. I am not a therapist. I don't play one on TV. I don't have a psychology degree. I can't give you professional advice. I can only give you personal advice based on my 20 plus years of being in therapy and my 58 years with borderline personality disorder. I only ask one thing of you. When you comment, please be kind. Be kind to me, be kind to everyone else, and be kind to yourself. Otherwise, your comment's going to go poof and vanish in thin air. And so will you. I have no tolerance for anyone being cruel. Please be kind. Please be respectful. We don't have to agree on everything. We just have to agree to be respectful and kind. If you like what you see, give it a thumbs up. If you're new to my channel, welcome, and please subscribe. It's absolutely free. And just remember that I'm coming on not as a therapist or a professional doctor or someone, with a degree in psychology. Today, we're going to talk about resistance. Resistance. Now, this can cover much more than borderline personality disorder. A lot of people think that we're the only ones who put up resistance. What is resistance? Well, think about, resisting something is trying to block it from happening, right? That's just like the, crackerjack easy explanation for it. It's like, for an example, a person in therapy who's trying to resist the treatment might want to talk about other things. Like a guy might come in and start talking about sports. Hey, did you see that Pats game this Sunday? Oh man, weren't they awesome? Or a woman might come in and start, looking around and saying, do you have any children? Is that a picture of your children on the wall? Trying to divert the attention of the therapist onto anything else except the reason to why the person is coming to therapy in the first place. It's kind of like a defense mechanism, if you will, so that, not to get at the trauma, the real, that real deep-rooted stuff that, is terrifying for us. It really is. And not only is it terrifying to talk about, but we have an extreme fear of abandonment. Do we really want to let this person in, to our inner stuff? I mean, a lot of the times I don't let myself in to my own inner stuff. So if I don't let myself in for all my life, how am I going to let this stranger sitting across from me in when this person could hurt me? This person could abandon me. So it comes in the form of resistance. Oh gosh. The term negative therapeutic reaction evolved as a way to describe how individuals with my disorder, borderline personality disorder, destroyed their well-meaning therapist's ability to be effective because of unconscious motivations of how do I pronounce this word? Masochism. Masochism. Sometimes I have a hard time pronouncing words, so yeah. I want to make sure I said that right. Now, where was it? Of masochism, envy, and sadism. In light of the reports of resistance to treatment and the formulations of the mechanisms behind this resistance that blamed the patient, borderlines became associated with treatment resistance and poor prognosis. At best, a diagnosis of borderline personality was a statement of therapeutic pessimism. So it was like, once a therapist hears, that this patient has borderline personality disorder, it's kind of like they kind of don't want anything to do with us, because they see it, only the negative side of us, as thwarting all the therapist's efforts, therefore making the therapist feel inferior. Now, this happened to me over and over again in my therapy. So I will talk about my personal experience. I don't like to just read off, a Psychiatric Times or whatever paper or, that I'm reading off of. I want to bring into my own personal experiences. I've had several, and usually the therapists were narcissistic, who told me, one psychologist, Dr. Newman, told me I made him feel impotent. Those were his exact words. You make me feel impotent. Another psychologist, Dr. Jeffrey Fortgame from Yale, said that I made him feel so inferior he couldn't function outside the office. He couldn't function in his family, in his home life. He couldn't function with other patients. Now, am I really trying to make these people feel, inferior? No. I feel inferior myself. What they're probably feeling from me is resistance to the therapy. In fact, which makes them feel inferior, because their role is to help me, and if I'm resisting their help, they're not doing their job. And if you're not doing your job, then you feel like a failure. The first time I saw Dr. Newman, I told him that I don't want to be here, which was the truth. I'm always honest, about things. I told him I was in marriage counseling with my husband, and the marriage counselor said that if I don't get my own therapist, he's going to stop doing marriage counseling. And I really like this marriage counselor. I liked him a lot. He said I was taking over the whole couples marriage counseling sessions with my own personal problems. So he told me, if you don't get your own therapist, then I won't do marriage counseling for you too. And me and my husband really needed help at that time. So I said, okay, can you find me someone? Can you recommend someone to me? And he said, yes, Dr. Eugene Newman in Norwood, in the Guild building. He's dead now, but he was a real, oh God, nasty. He really abused me. He emotionally and verbally abused me. But I did go into the therapy saying that to him. I said, I don't want to be here, but I need to come, because my marriage counselor said if I don't get my own psychologist, he wasn't going to see me anymore. So right away, it's like if someone said to me, I don't want to watch your videos, but my psychologist said I had to watch a video on borderline personality disorder before my next session, or he wouldn't see me. So I said, oh, well, I might as well watch hers, since I'm forced. My psychologist said I had to watch something. See? Now, if someone came to me like that, how would that make me feel? That would make me feel like, oh, you don't really want to watch my video. You're not really interested in what I have to say. You don't really find me helpful. You're forced into it because your psychologist said you had to watch a video on borderline personality disorder. So you just said, what the hell? I'll just watch hers. you know. So that's how I made him feel inadequate, inferior, in his exact words, impotent. And maybe that was a form of resistance. Like looking back, how they always say hindsight is 2020. I think I was resisting the treatment because I didn't want it. I just wanted to go to therapy with my husband, which is safer because you're with someone else. You're with instead of just being alone. I mean, if there's another person here, if you're really afraid to talk about your inner self and your problems, and like you have another person with you during an interview or something, it kind of like takes all the pressure off of you because there's someone else here who's going to talk. But like if it's just me, then the spotlight's on me. Oh God, I gotta set up this again. Here I am just trying to be dramatic with y'all. I think it's a little darker here now that I have the light position. But all right. So we're getting back to, resistance in therapy, and I just gave you a great example of how I resisted this psychologist, and he really couldn't handle my resistance. It made him feel inadequate. All right, what else does it say about... Yeah, they say they're defense mechanisms. Let's see. They give you vignettes, but you know what? I'm not going to go into all the vignettes because I just gave you my own real life vignette about resistance in therapy and how that affects certain psychologists. Now, I'll tell you what I think a good psychologist would do with that. I think that a good psychologist will just, go with the flow. If the person is resisting you, let them resist you. Eventually, they're going to want to talk because that's what they're there for. And if you don't cater to them, for instance, like with other therapists, when I try to resist, I would get them to talk about themselves. Like a perfect example, Dr. Jeffrey Fortgame. He was in a band, and he wrote a famous song for Rod Stewart. Some Guys Have All the Luck. If you look up that song, you'll see it says Jeffrey Fortgame. He wrote that song. So I got him to talk about that a lot because, well, he loved it. Who doesn't love talking about something that they love to do, right? If you paint and I start talking about paintings in your artwork, or how do you do that, or how do you start out? Do you sketch it first, or how do you, what medium do you use? Do you use watercolors? Do you use oils? Do you use whatever have you? You know what I mean? If I start asking you questions about something you love to talk about, that's something that interests you, then I'm diverting the attention away from myself and onto you. So that way, that's a form of resistance. And if the psychologist, gets wrapped up in that, then they're, aiding and abetting the patient in resistance. What they probably could say is, I'd love to talk about, my artwork or something some other time, but we're here to talk about you, and not like aid and abet, help, encourage the person to keep resisting. I mean, that's encouraging it by going along and talking about yourself instead of, not saying anything. Silence is really damaging. I feel very uncomfortable in my therapies when there was this silence, but I think that's really good. One psychiatrist asked me, why do you feel so uncomfortable with the silences? That was a good question. See, a good psychologist, therapist, psychiatrist, whatever, won't tell you what to do. They will ask you questions to make you think. They'll never tell you what to do, but they will plant a seed, so to speak, by asking the questions. And he didn't have any problem, with the silence. I had the problem with the silence, you know. So, and he wasn't going to engage me in anything outside of what I was there for. Like, he had much more confidence. Dr. Torchin. Dr. Robert Torchin was also my father's psychiatrist. My father had paranoid schizophrenia. I wrote a whole book about him, Life with My Schizophrenic Father. And after my father died, I wanted to meet. I never met Dr. Torchin, and I called him up and I said, Dr. Torchin, do you remember Anthony Palladino? And he says, oh, yes, I do. And I go, well, I'm his daughter, and I'd like to have a session with you. I'd like to come for therapy. And he was fine with that. I told him my father died, and he felt sad that he died. It didn't work out, though. None of these therapies worked out. But he had an air of confidence, Dr. Torchin. Great confidence. I did not make him feel inadequate. I asked some questions about my dad. He answered them, but he didn't remember much. He didn't elaborate too much about my dad. I think I just went to him to find out about my dad. That's the truth. My dad had died, and this was his psychiatrist. I never met him before, but I heard his name in my household all the time. I heard my mother talking to him on the phone. Dr. Torchin, you gotta help me, Dr. Torchin. That's what I heard growing up all my life, so I finally wanted to meet the Dr. Torchin face to face, and I became his patient for a couple of months, and I talked about my dad. But I think that you can't, give in to a patient. It doesn't have to just be borderline personality disorder. It could be any of, the personality disorders. The cluster Bs usually fall into this thing, this resistance. It could be narcissistic personality disorder. It could be bipolar. I don't know. It could be any one of these, right? So I just think that it takes the focus off of the patient, and it's a defense mechanism, definitely, because you don't want to get at that really deep, painful stuff inside. And if you're a good therapist, it shouldn't, you shouldn't aid and abet it, okay? You shouldn't just talk about anything with the patient and give into their resistance. You might want to point out to the patient, it feels like you're resisting me, You could point it out to them, but to feel inadequate, that's not that's countertransference. That's the patient is making you feel something. You're reacting to something the patient is doing. And once you get into that reactive mode, when the therapist does, the treatment really goes downhill. It goes, it doesn't go anywhere. You can't really help. And of course, being defensive, if the therapist is defensive about the resistance, then they're not going to be able to help you. So, I don't know, maybe if therapists are watching this video, it can help them, because, don't encourage the resistance. Don't give into it. Don't let it affect your ability to help the patient. Don't allow the patient's resistance. It's not about you, it's about them, their fear of abandonment, my fear of abandonment, my fear of trusting someone else. I'm trying to, not talk about, the deep pain, the turmoil, the trauma inside of me. So I try to divert it to anything else but it. Question the resistance, It's fine to question things, I think that a good therapist will question it. But so anyway, they say that's why it goes, and they say patients with my diagnosis don't do well in therapy because they put up this wall of resistance, and the therapists don't really know how to deal with it. Also, entitlement is a form of resistance. Entitlement. Didn't This is what we started with, wasn't it? Entitlement. No, I think it was we started with resistance, but now entitlement to special treatment. Um, Borderlines often seek approving forms of attention from those who treat them. Such appeals for special treatment may prompt the therapist to worry that gratifying them can reinforce unrealistic interpersonal expectations, but that withholding may elicit reactive worsening of symptoms or dropping out. So the patient is acting entitled because the patient wants to feel special. I don't think it has anything to do with arrogance like people think it does. I think that they want to feel special. It's not that they feel superior or better. It's just that they never really felt cared for. I think this mental illness stems from childhood trauma and abuse. It did for me anyway. And I think it does for a lot of people with this illness. Not all people, right? Not all, but a lot. So they do want to feel special. I think by feeling special helps them more. And with me, by feeling special by my therapist, it helps me to open up more to them. I need to feel that, love and care. I need to feel that specialness in order to open up to the therapist. And a lot of times, if I don't feel that connection, I will drop out of therapy. Then if the patient drops out of therapy, how are you going to help them if they drop out of therapy? They give all these vignettes, but I really don't want to go into them. But I'm just here to say that if a patient acts entitled, especially with borderline personality disorder, it's not out of arrogance or conceit or feeling that, they deserve so much more than anyone else. It's just out of feeling unloved, It's feeling not cared for, feeling unloved, feeling abandoned, frightened, They just need that extra assurance. That's what it is. That's what it was for me. And once I feel that extra assurance, then I can open up more. And I have in therapies, but it's always gone south. Every therapy has been different, and I don't have time to sit here and talk about each individual therapy that's gone south. But I noticed that once I feel a strong connection and there's a mutual camaraderie and care and specialness between me and the therapist, that does allow me to open up more of my inner trauma that I've suppressed all that time. So that's what it is. So I hope I touched a little bit about that. There's so much more to say, and I don't want to keep going on and on in this one video. But let me know your thoughts about resistance in therapy. Have you resisted? Someone who has. What are your thoughts on it? Have they found any good therapists? And thank you for the guys who write in and tell me about what it's like to be a borderline and a male. I really, really appreciate it. Okay, till next time.